Today I'm going to be giving an intramuscular shot. So I have to get the supplies for it. For doing this, you need a needle and a syringe. I'm going to do a 3 milliliter syringe because you can lock it with the needle and that's beneficial, especially intramuscular. I'm going to get a 1-inch needle because that's appropriate for an intramuscular injection. And then I'm going to get medication. Alright, I'm going to do Lovenox. I need tape. I need gloves. And I need wipes. Ooh, alcohol. No.
It's in the last one, I think. In this. There's one.
Okay. And here we can go across. They have some over there now. Here, we'll just go right over here.
Or just use one.
No, I can't. That's not proper. Okay, so next after that, you have to check your supplies. So ordered by the doctor was 100 milligrams of Lovenox. This is 100 milligrams per 1 milliliter, so I'm just gonna pull out 1 milliliter when I do it. You have to clean the top of it to keep it sterile. You wanna keep away from infection as much as you can. Okay, and then you look at your supplies. This is intact, it's unopened, it's sterile. It's also unexpired. The needle is also intact and unopened and unexpired. Its expiration date is 2021, so we're good. So next, I'm going to open up the syringe, and you kind of do it like a little hammock. And you just keep it in there. And then next, you open up the needle. You try to avoid touching it because you want to keep it as clean as possible. I feel like I'm in a movie. So you open this up like a banana so you don't touch any of it. You want to avoid getting pricked yourself. And you hold this. And then since this is a lock, you just twist and now it's locked together and it won't separate. So it has its safety on. Like I said, it was ordered for 1 milliliter, so I'm going to pull out 1 milliliter in it. So I remove this. And I'm going to take off the cap. Well, not yet. You actually have to pull back in air. You need to get 1 milliliter of air so you can replace it with the medicine. So now I'm going to take off the cap. And you put this in. Then you flip it. And you put in the air. You want to make sure also that the needle's covered. Otherwise, you're just going to pull out more air. And you pull. You want to avoid air bubbles, which can be difficult, but you just work it out until you have enough and it's the full 1 milliliter. So I over pull, and then you flick it until you get rid of the bubble. Little bubbles are okay, but you want to get rid of any big one. So then you push back up because I want to get to 1 milliliter. And then you can pull out. And then you want to recap. You don't want to use this hand because you don't want to prick yourself, so you just swoop it up with one hand. and then once it's covered, you can use your other hand and recap. Now that I have that, to be safe and make sure it's the right patient and everything, I'll get a piece of tape. And then you write on it the patient's name, how much this is, so it's 100 milligrams per 1 milliliter of Lovenox. And then you'd also write what the order was for this patient and what I have. So I also have 1 milliliter of Lovenox, which is 100 milligrams. Then I'd write the date, time, and my initial. This also, you want to make sure the medicine doesn't expire, and it doesn't expire until 2030, so it's safe to give. When I'd go bedside, I'd also do another check. You want to make sure, it's a huge thing with medicine, you want to make sure that you give the right medication at the right time to the right patient the right way. So you go through that, it's called a MAR, and you compare your medicine to the MAR, and you do it 3 times just to make sure, so you give them the right thing. So now that I have this, I'm gonna bring the rest of my supplies, which is the glove, another wipe, and the medicine, and the shot. So now I can walk over to my patient. We're giving an intramuscular shot. Intramuscular shots can be given in multiple ways. I'm gonna choose to do it on the vastus lateralis, which is on like your side of the leg. You can also give it in the butt, and you can also give it in the arm. I'm just choosing to do it on this way. My patient, so first you'd knock and identify yourself, and the patient would be okay with it. You'd ask for approval. You'd have to wash your hands because that's big for sterility. You tell them exactly what you were doing. You have to landmark where you're giving the injection. So when you're doing this, I'm gonna grab my patient and show you. I wanna do vastus lateralis. So I find the greater trochanter, which is right here. You put your hand there, and then you go right behind the knee, but this obviously doesn't have a knee. So I'd move my hand one over. This is where I would give my shot. You don't want to come over, but you also want to be right in that area. So now that I've landmarked that, I'm going to layer it back down. I'm going to put my gloves on because sterility. I don't want to prick myself. I don't want to get any of their blood on me, and they don't want any of my blood on them. So now I get my wipe. I'm gonna bring this over for me so it makes it easier so I don't have to reach everywhere. So I'm gonna bring my patient back over. Find the greater trochanter, go here, here, here. You're giving it right there. You clean it, and as you grab, you want to clean from inside to outside. It helps keep it cleaner, and then I'm gonna lay that there so I can get my needle. You take the needle out, set that down, and you just tell the patient it's gonna be a little prick. And I'm gonna count to 1, 2, 3. For intramuscular, you pull the skin taut, so you pull it apart. If I was doing subcutaneous, I would push together. But since I'm doing this, I'm gonna pull apart. You hold it like a dart, and then you count to 3, and you just go straight down at a 90-degree angle. 1, 2, 3. I'd move my hand over to hold it now, so it's stabilized. And now I'd push all the fluid in. Slowly, you don't wanna do it too forcefully. And then for my safety, I'd pull away, I'd hold her, and I'd take this out. It has a safety, and you cap it. Is there anything else I can do for you? They would reply no. If there's any fluid leaking, I'd put another swab on it or put a Band-Aid on if there's any bleeding. And you lay him back down. This goes straight into the sharps container because you don't want to get pricked. And then after that, you remove your gloves, you make sure your patient is safe. And next is documentation, and you document that you gave the medicine and when you gave it, where you gave it. So then it's not given in the same location and that someone else won't do it for you because you already did all the medication. But that is how you give an intramuscular shot.